The visual acuity station assesses the patient's ability to see long distance with the use of a Snellen chart. Have the patient stand on the tape on the floor facing the Snellen chart. At this station, you will fill in the column marked SC and pinhole. SC stands for sans correction, as in they are not wearing glasses or contacts. If the patient is wearing glasses, check their visual acuity with their glasses on. You will fill in their result in the column marked CC, which stands for with correction. If they are wearing contacts, fill in the information in the column marked CCCL, which stands for contact correction. Hand the patient the occluder covering the patient's right eye first. Make sure the pinholes are up and out of the patient's view. Start with a middle line on the Snellen chart, point towards the first letter in a line, and ask the patient to read the line out loud going left to right. If the patient names the letters correctly, continue on to the next line. If the patient is unable to read any letters in that line or guesses at the letters incorrectly, move up a few lines and use that as your new starting point. Continue your way down the Snellen chart until the patient misses more than half the line. This is considered failing that line, and write down the measurement from the previous line in the appropriate column and add how many letters they got correct in the last line tested. For example, if the patient is reading the 20/30 line and they miss more than half the line, their visual acuity will be the number listed on the line above, 20/40, plus the number of letters they got on the 20/30 line. If they get more than half the line, but some errors were made, continue to the next line. In this case, that next line would be 2025. If the patient gets less than half of the 2025 line, their visual acuity will be 20/30 plus the number of letters they got right in the 2025 line. If they cannot read anything on the 2025 line, but got more than half of the 20/30 line, then their visual acuity will be 20/30 minus the number of letters they got on the 20/30 line. Once you have assessed the patient's visual acuity, document the number in the appropriate column, either CC or SC. You will then test the vision with the pinholes. Here you can see the pinholes on the occluder. You can drop these down and instruct the patient to find one hole and look through that hole only. The purpose of the pinhole is to limit the amount of light entering the eye. This should improve the patient's vision if they have a refractive error. Start with the smallest line the patient just read and repeat the same steps as before to come up with a new visual acuity. Write this number down under the pinhole column. Now, you'll perform extraocular movements and concentration fields, which is illustrated in the following video.
There are 3 cranial nerves that control the muscles for eye movement: cranial nerves 3, 4, and 6. We can test their functioning by standing roughly 2 to 3 feet from the patient and having the patient follow your finger with their eyes. Hold out your hand with one finger up, instructing the patient to follow your finger with their eyes only, and keeping their head still. Start in the midline and draw the cardinal H in the air.
The most important part of performing a confrontational visual field exam is patient and examiner positioning and providing the patient with simple and concise directions. First, have the patient remove their glasses if they are wearing any, as glasses can create artificial field defects on exam. Both the patient and the examiner should be seated with their knees almost touching and their heads at equal heights. Positioning is important because you will basically be checking your own visual field against that of the patient, and if the two visual fields are not lined up symmetrically, the test is not accurate. Tell the patient to look at your nose and ask if any part of your face is missing. Next, hold both of your hands up on either side of the patient's face, making sure your hands are equidistant between yourself and the patient. Tell the patient to look at your nose and ask how many hands they see. Finally, ask the patient to cover their right eye while you close your left eye. Instruct the patient to continue to stare at your nose while you proceed to hold up 1, 2, or 5 fingers in each of the 4 quadrants of their visual field asking them how many fingers they see. If the patient's eyes start to wander around, simply instruct them to keep staring at your nose and repeat the exam for that quadrant. Repeat this procedure for the other eye as well.
Finally, you need to know how to document the patient's vision if they are not able to see the biggest letter on the Snellen chart. The next step below is count fingers, abbreviated CF. Stand 5 feet away from the patient, or roughly halfway between the Snellen chart and the patient, and hold up different numbers with your hand and see if they can recognize your fingers. If they can, their vision is count fingers at 5 feet. If they cannot, keep moving closer to the patient by 1 foot until they can count your fingers. If they can see at any point during this transition, document their vision as count fingers at the distance they could count your fingers. So, if they were able to count your fingers at 1 foot, their visual acuity would be CF at 1 feet. If they cannot count your fingers at 1 feet away, the next step below is hand motion, abbreviated HM. Stand 1 feet away from the patient and tell them to say yes when they see your hand moving. If they are able to see your hand move, then their vision is HM or hand motion. If they are not able to see your hand move, the next level below is light perception, abbreviated LP. Ask the patient to say yes if they can see a light shining in their eye. Shine the light in the patient's eye several times, and if they say yes to any of those attempts, then their vision is LP or light perception. If they are not able to see the light shining in their eye at any point, then this is the final level and the patient's vision is NLP or no light perception. After you are done assessing a patient's visual acuity, their extraocular movements, and their confrontation fields, direct the patient back to the waiting area